Eileen Cavway on my team so that I can do it on my computer.
When you used to be with Gail, right?
No, but I worked for the Manhattan Borough President's office before. So I was the head of Northern Manhattan. And then that was like when I first started. And then before that, I was the liaison.
Who was the president then?
Scott Stringer. Scott.
You worked for Scott. Okay.
Yeah. Scott was a VP at that time. And then before that, I was a rep for East Harlem and Washington Heights.
Okay. Got it.
So I've been, and I worked for the mayor and the mayor's. I'm like one of those people that,
I love it.
I thought we had met on Roosevelt Island for some reason.
Yeah, that was when I was in DYCD.
Okay, that's it. Okay.
I used to work for Commissioner Mulgrave.
Okay.
I was the head of external affairs at that time, and that was when we were doing the MOU for the greening. So I was the point person for that.
Are you Jamaican with these 18 jobs?
I had one job at a time at the city doesn't let you work for other people.
That sure don't.
They don't. Trust me, I've tried. I'm like, but can I teach though? But can I?
Hey guys, for those who are rolling in, we're going to start in just a couple minutes. We're going to give everyone a chance to log on. I see the numbers kind of rising, so we'll give it about 3 minutes. Welcome everyone. If you want to grab a glass of wine, a cup of coffee or whatever, I know it's after work, 6 o'clock, chill out time. So grab that really quick and we will start at about 6:07, 6:08. Hi Mia, how are you?
Hello, thank you for joining from South Africa. I know it's late.
No, thank you for joining me.
Oh, wow.
Good morning. And then I guess for those who are in the room, if you guys have any questions during this Zoom, please use the Q&A. I'll be forwarding those over to Radia, so get your questions answered.
Yes, this is going to be a really good conversation. We are ready to delve into these topics.
Yes.
Been a very
interesting
deep breath. I'm just like, it's been
I know, but interesting couple of months,
Yeah, short amount.
Today's the ideal day to do this actually, because on Tuesday. So it's a perfect day to have this conversation.
Yes, definitely.
Yeah, but y'all better talk quick before y'all got to get back in the house.
I know we got a curfew, right?
Yeah, you got a curfew.
Yes, before 8 p.m.
That's right.
You're in New York.
Hi, Lakeisha from Virginia, President of Virginia NAMIC. Welcome. Thank you for joining us. I just want to also let the panelists know this is very casual. We're just going to free flow, but if you have to drop off, just go ahead and drop off. It's fine. We'll keep the conversation going as we can, as long as we are able to. But I know a couple of you have some engagement. Right? Engagement is fine. So we're going to give it 1 more minute, and then we are going to get this rolling.
Okay.
Let Carvel set it off.
Sure.
Set it off, Carvel, in 1 minute.
1 more minute. All right. Looks like we have a nice room this evening. So really excited about that.
I'm not used to seeing myself with real clothes on. I'm like, wow, okay. I'm very much like a leggings and t-shirt, sit around on the couch all day and do my work.
Yes. I see Susan from NAMIC Nationals here. Thank you for joining.
Hi, Susan. We're in here. NAMIC is in here deep.
Yeah.
Welcome, everybody. Okay, so I think we're going to get started. I just want to welcome everybody for joining us. Thank you so much for taking time out of your afternoon to hang out with NAMIC New York. I'm going to turn it over to Carvel, but I just hope that everyone is really being well, protecting your mental health, protecting yourselves physically when you go outside. I hope that you are still practicing your social distancing and your hand washing and all that good stuff. Things are looking so much better in New York City, but we have to still kind of stay on point. So I went out earlier today very quickly, and I saw so many people out, so many cars and so many people, and I was like, oh my goodness, we're not really all supposed to be out like this. So, okay, I'm gonna turn it over to Carvel.
All right, thank you so much, Radia. Really do appreciate that. And good evening or good morning, wherever you guys are joining from. My name is Carvel Wallace, and I'm the Vice President for NAMIC New York. Just give you guys some background about NAMIC. NAMIC is the National Association of Multi-Ethnicity in Communications. We are here to empower, educate, and inspire, and especially in these times, definitely need that education, advocacy, and inspiration, so definitely do appreciate it. Some more background, NAMIC NAMIC New York has 850 plus members, all here in New York City. And throughout the country, we have well over 4,000 members with 18 chapters. So if you're not a member, you can find more information by going to NAMIC.com. You can also check the local chapter out at NAMICNewYork.com, where you can find out more information. Also check out our social media pages so you can stay abreast of everything that is going on, NAMIC_NY, same with our Twitter, LinkedIn, Facebook pages. And also we're now on YouTube, which is new for us. So,
Fancy. We're very fancy.
Yeah, so again, just here to really just inspire, empower people, professionals of color to elevate themselves, and especially in these times, now more than ever, we definitely need it. So definitely want to thank you guys beforehand for doing this Zoom this evening. Really do appreciate it. So with that being said, I'm going to turn it back over to our moderator and President Radia Barnes.
Thank you, Carvel. Okay, so we're going to get started. I just want everyone, we have a great panel. Like, I am so impressed by this panel. This is a wonderful, wonderful panel. Thank you guys for joining us. Quickly, if you could just introduce yourselves to us, tell us a little bit about what you do and a little bit about your background. I'll start with Wendy.
Sure. Hi, everyone who's listening. I see that we have a good room. My name is Wendy Garcia. I'm the Chief Diversity Officer at the Office of the New York City Comptroller. I think I'll keep it super short, but I will say that my position is a first in New York City. It was created when the Comptroller first came into office, and my role is to ask the big question is, how is the city of New York utilizing its dollars with women and people of color? And I'll talk a little bit more about that. How that
I love it. I love it. Nick E. Smith, can you quickly introduce yourselves to us?
Not a problem. Thank you. Good evening, everybody, or good morning over there in South Africa. Pretty impressive. My name is Nick Smith, and I am the first deputy public advocate in the administration of New York City Public Advocate Jumaane Williams. Folks who are not from the city may wonder, what is a public advocate? Long story short, it is the city's watchdog, and our job is to hold accountable city agencies. And a couple of tools we have to do that are passing legislation, engaging in investigations of agencies. So those are two tools we use to be the city's watchdog. Thanks for having me.
Yes, thank you. And you guys are doing a great job over there too. Thank you.
Thank you.
Congresswoman Grace Meng.
Hi, Radia. Hi, everyone. I'm Grace from Queens, New York. It's an honor to be on with all of you. I have been in the New York State Assembly. I am currently now serving parts of Queens in Congress. I am a member of the Senator Parker fan club, and it is wonderful to be here with all of you. We talked a little bit about the importance of therapy, and I look forward to this discussion.
Yes, thank you so much. I am too a member of the Senator Parker fan club. Senator Parker, please introduce yourself.
For those who are not currently members of the fan club, I'll put the information in the chat so you can join. It's just a small fee to join. I'm State Senator Kevin Parker. I represent the 21st District here in Brooklyn, which is part of Canarsie and part of Flatlands, but principally Flatbush and East Flatbush, Midwood, Ditmas Park, Windsor Terrace, and Park Slope. I'm the majority whip in the New York State Senate, as well as the chairman of the Energy and Telecommunications Committee. And happy to be here. I'm actually also, I think I'm a member of NAMIC. I'm supposed to be. I think I sent my check in. I don't know if I cashed it, but I'm a member of NAMIC.
We saw that check and we looked a little suspect, so I don't know.
You are a member, Senator.
Okay, thank you.
Thank you, Carvel. Carvel's on top of those things.
Thank you very much. And by the way, Congresswoman Meng is being very humble. She's actually the second Asian American ever elected to the state legislature. And since been in Congress, has been one of the youngest members in Congress, doing a great job, not just representing her district and representing the state, but also fighting Donald Trump and doing a lot of important work for the entire country. So thank you for your service, Congresswoman.
Thank you. Yes, I read her bio. It was very impressive.
Impressive, yeah.
Yeah, thank you. So I just want to read a couple stats that I pulled. Some of the hardest hit communities of COVID have been Black and Latino communities. They're dying at twice the rate of whites. Some of the hardest hit areas of New York City have been the Bronx, Brooklyn, which was Starrett City in Brooklyn, Far Rockaway, where in Far Rockaway there was a 1.5 higher death rate than Gramercy Park, compared to Gramercy Park, which is a white neighborhood. 75% of frontline workers are people of color in New York City. People of color are 3 times more likely to know a victim of COVID. Blacks are dying at 3 more times the rate of whites. The US Census reported that Latinos make up 18% of the population, but are 29% likely to die of COVID, have died of COVID. Reports of bias on Asians have skyrocketed during the pandemic. In 1 week in March, there were 673 reports of attacks on Asians in New York City. From the weeks of March 17th through May 4th, 40 people were arrested for social distancing but 35 of those were Black, 4 were Hispanic, and 1 was white. So my handwriting is so bad I can't read my own handwriting, but I just wanted to throw some of those statistics out just to kind of let everyone know how hard and how bad the COVID virus has hit our communities. Communities of color have been devastated by this virus. So I just want to ask each of you, how has the virus affected your communities and the communities that you represent? I'll start with Congresswoman Grace Meng.
Sure, Radia. And I think that this question is not only important right now, but it's going to become even more important in the weeks, months, and years ahead. We have seen the results of a lot of systemic disparities that we probably all already knew existed, but they've been on full display during this pandemic. You know, in the early weeks, late February, early March, for example, we were asking basic things even from the federal government, to get information out in multiple languages. They were giving us instructions like safely quarantining, but we all know that many of our neighbors and our constituents didn't have the luxury to safely quarantine. They might live in crowded apartments. They might be living with multiple generations. And they might be essential workers. And we've seen that most of the people, at least in my borough of Queens, who have died from coronavirus, most of them are people of color, and most of them had underlying health conditions. So we need to address a lot of the disparities that existed way before the coronavirus.
Yes. Nick, why do you think that there has been why do you think it has hit our communities so hard the way that it has? So I know that you worked for the Public Advocate. Do you have any insight into that?
Yeah, I think it's probably a lot of what we've been learning over the recent days and months. And I think the Congresswoman really said it super clearly. We're dealing with, and I'm going to be blunt about it, systemic discrimination, systemic racism that does, as the Congresswoman said, just go back generations. And by systemic, that sort of means it's built in, it's a pattern, it's a practice. So we can even talk about particular constituencies, for example, frontline workers. The vast majority of those workers in the city, if you talk about, for example, MTA, or if you talk about doctors, or not doctors in terms of Black and brown folks, unfortunately, right now, but nurses and other medical professionals, the vast majority of those are Blacks and Latinos. Well, they're quote essential workers, and they had to go to work. And so while many folks were beginning to quarantine, I think, too late. And that's, in my opinion, I'm going to be super blunt here, a failure of the mayor and the governor to act quickly enough. But folks were told, you got to go to work. And then we talk about testing. That's another huge disparity that still hasn't really been resolved. We hear the term PPE, personal protective equipment. That's a failure at the federal level primarily, but also state and local. Why is it that we have frontline workers begging for ventilators, begging for masks? Because we knew, or we learned very quickly, how quickly the COVID-19 was spreading. The data just shot up. And unfortunately, we didn't follow the model, for example, of places in California. So if you look at San Francisco and their minority communities as well, and frontline workers, they had a much quicker response. So I think if we had had a shutdown or a pause or whatever you want to call it, even a week earlier, there would have been a lot less infections and deaths. And yes, those infections and deaths, the bulk of those, unfortunately, were in the minority community.
Yes. Sadly.
So Radia, like I know there's a it's in vogue to Monday morning quarterback. We're not even nearly through this thing already. There's some significant differences. And I've said this to a number of folks, and this is an ongoing thing between my very good friend, Jumaane Williams, our public advocate, who I co-chaired his campaign when he started about this issue. But the reality is that New York City and San Francisco is apples and oranges, right? We're talking about the largest city in the country. We're the home of the stock exchange, right? With almost 9 million people. San Francisco is about the size of Staten Island, right? And shutting down Staten Island is a different thing than shutting down New York City. And so that's some of the dynamic I get about that. But the reality is that we all agree that a lot of the problems that we had less to do with when and where we shut down, and the fact that a lot of the pre-existing conditions existed in our community already. That really, that what COVID did is lay bare the wounds of oppression and racism and social inequality that's been existing in our society for a long time. And again, you heard the Congresswoman say, is that in our communities, we're already sicker. There's already health disparities that exist there, many because of the people who are supposed to be serving us. And so we have the largest numbers of people who are being underdiagnosed and misdiagnosed. And when you look at those numbers, it's not even, the scary part is that even having a Black or Latinx health provider doesn't even protect you from that, which is interesting, right? It's only education that helps you get past those health disparities. You then have, on top of that, the highest numbers of comorbidities. That is that people not just have asthma or just have diabetes, they have diabetes and they have asthma, right? And then people have the most numbers of people with compromised immune systems, the most people with HIV and AIDS, the most people with lupus, the most people with things like cancer. And so even if people have battled cancer and won, those treatments leave their bodies, immune compromised. Then again, as you heard Nick, and I'm sure Wendy agrees, that we are the frontline workers, right? We're delivering food, we're delivering packages, we're working in the post office, we're working in grocery stores, we're driving buses, running the trains, right? We're the health workers, the nurses, and growing number of the doctors. And then as we leave those jobs, we then go to the most concentrated, overcrowded communities in the nation, particularly here in New York, right? Another significant difference between New York and San Francisco, for instance, is that the density of New York is much higher because we're an archipelago, fancy word for a group of islands, and our cities are vertical cities as opposed to being more spread out like you see in California and a lot of other places, right? And so people are going into the Marcy houses and you sneeze in the elevator, and now the whole building got COVID, right? And then once we get sick, unfortunately, we're then dependent to go back to the people who misdiagnosed us and underdiagnosed in the first place for them to treat us. And so, and we have places like East New York and Brownsville and East Flatbush that are healthcare deserts, right? Where literally they have one institution, Brookdale Hospital, where everybody is dependent on going to. We have very large Medicaid patients there already. The reimbursement on Medicaid hasn't changed in 20 years. These hospitals are already underfunded and underdeveloped. as it relates to services. Elmhurst is another example of an HAC hospital that was just not, not ready for the moment. Brookdale's not an HAC hospital, Elmhurst is, and just not ready for a pandemic. And so we've just been laid bare by this. And so it's really been devastating. And when we talk about the statistics, that's one thing, but all of us have probably on this call went through March and April with almost every single day hearing a new person was sick or a new person died. I know I went personally 2 months with hearing either somebody I knew personally had died or somebody close to me had lost somebody because of COVID. And it's been a lot. And we're not even yet properly assessing the mental trauma that people are going through, which frankly, I think is part of what leads us to this moment that we're in now around police reform. Because as we start then coming out of this, you then get an overreaction by police officers around, around social distancing and wearing masks, and that on top of everything else, it's enough. It was a powder keg, and the police threw a match into that, and so here we are. So there's a lot of work to do.
Yeah, definitely. And just to piggyback off of that, and I think we all know the answer to this, but Wendy, I heard someone say social distancing is not a luxury that everyone can afford.
Yeah, absolutely. I think we see it very clearly in dense communities. I think if you even look at the breakdown of where COVID is happening across the city, it's happening in communities where people live in close family niche. And I say close family niche to also, the other side to that is that you have 2 and 3 and 4 people living in a house. You have the grandmother, you have the mom, the dad, you have multiple people living in one household. And then you also have a dense environment. Senator Parker's right. New York City is a dense area by default. It doesn't matter where you go. And when you couple that with poverty, you couple that with lack of resources, you couple that with a health disparity, what you're going to find is that we have been living in this virus for a long time. This is not the call of COVID is really just an exposure to what has been there for years and centuries. And to go back to the earlier point in that, what is it that we think has caused this? Systemic racism has been going on for a long time. Nick talked about that. The Congresswoman talked about that. And we even see it in the way the city is created. I mean, I can tell you from my perspective in looking at how the money moves across the city from just a controller's office. Out of $20 billion that the city spends, only 5% goes to women and minority-owned businesses. Now, what is that really saying outside of the 5%? It's we're not building communities. It's really saying that we're not investing. It's also saying that we're not building wealth. And when we don't build wealth, you can't move out of dense spaces. You also cannot have people leave their particular homes. It doesn't allow for home ownership, which means you have dense communities, right? So this is what Senator Parker said earlier. There's this one string and the common thread is racism. And so we have to take today is Blackout Tuesday, and to really talk about this for what it is, which is just a exasperation of what racism has done to our country. This idea that we have been separate but equal, this concept that health disparities are existing somewhere in the nuance and the far away. It's all the same thing. We have a system that has kept out communities of colors for centuries, and the whole thing needs to be reformed. That's what people are calling out about today. That's what the protesters are talking about. That's what we all have been working really hard for in government, and how do you reform? It's why Grace runs for office, and I want to clap and say, that's amazing. She is the Asian representative, but man, we're in 2020. We're in 2020. Like, what about our system has stopped previous people from running? What about our system has not allowed for that 5% number to be 80%? The other number that we never talk about is 80% of New York City is either a woman or a person of color. So you tell me, why is it if 80% of people are women or people of color, and only 5% of the dollars are going there? What's the problem here? we have a government that needs to be reformed, it needs to change, because it's not serving New Yorkers. At the very least, it's not serving the majority of the people. And we do have to start changing that mentality from going to minority to majority, because that's really the culture shift that we need to start talking about, in that we are no longer the minority community. If you don't serve us, you're not serving anybody.
Right. And just not even taking into consideration the protests, do you think that this is a wake-up call for the government? Let's just, even New York City government, for them to see these numbers, for them to see all these people of color dying at these alarming rates, do you think it will make a difference? Do you think it will change anything? And anybody can answer that.
I think, I mean, I will defer to the elected officials on the call for sure. But I'll tell you from a data perspective, is that the facts right now from a data perspective is that whatever we're doing right now is not working. That's clear. When your health disparities are up, the government spends more money. That is not good. When you have homelessness, the government will spend more money. That is also not good. When you have equality, you have efficiency. You can even see it in the smallest spaces where you have equal access to contracts, equal access to competition. You get better prices, you get better diversity of thought, you get better quality of the way things get done, better decisions are being made. It's just equality breeds efficiency, which is also better for government. And so I think a lot of what we need to think through is not just reforming of how the machine is working, but really taking a long look at these old regulations that have existed for many years that were governing how we did things, and sort of like move ourselves out of that. We need to just throw those things away.
Yes. Nick,
I
what do
mean,
you
if I
think?
could,
So go ahead, Congresswoman.
if I could piggyback off of what Wendy was saying, I think one of the most recent examples of that is with the laws that Congress passed recently in addressing coronavirus relief in terms of the PPP loans that were originally intended to help our mom and pop shops, the ones in our neighborhoods, on our blocks, the ones that we depend on every day. And you know as well as I do that in the early weeks, we were still hearing from our constituents, our small businesses, that they weren't getting access to the loans. They couldn't even get their banks and lenders to call them back. And so this is an example of what Wendy's talking about the need to reform government and to improve the infrastructure. Because of long-time existing relationships between big companies like, you know, Shake Shack or Potbelly and their big banks, they were able to get the loan right away. Whereas many of our mom and pop small businesses, maybe they have language obstacles, maybe they don't have the right connections, and weeks and months went by before they were able to get it, until Speaker Pelosi and the House Democrats tweaked the way that the business loans were being set up, allowing our smaller community institutions and lenders to be able to have more access and to carve out a chunk of the budget so that our real mom and pop small businesses were able to access these loans.
Nick, you wanted to say something else?
Yeah, I think the answer is to be decided, and I think it does depend on what in particular we're talking about. So let's just take one quick example of healthcare and insurance. We know several years ago that the federal government and President Obama passed Obamacare, which increased healthcare insurance coverage for millions of Americans. But even that that wasn't universal healthcare. There's many millions of people that are still uncovered. And so one, you know, we have to have the political will, and I'm not talking about Congresswoman Ming, but we need the Congress and the president, obviously not this one, to really look at, can we move to Medicare for all, or a system that will cover all Americans? And then even below that, once you're covered, there's issues of you know, access. So for example, I have two new baby girls, twins, Grace and Faith Smith. They're 10 months. They were born 10 months ago. I saw firsthand what my partner went through in complaining about pain that she was going through the labor process. She had her issues really ignored by the doctors at that high-ranked hospital that I won't name. This is a woman who has, she's professional. She's a nonprofit executive, and that's a level of privilege. Well, we shouldn't need privilege to receive adequate healthcare. And so healthcare alone remains a big problem, particularly in our communities, particularly when we do not have universal healthcare. And then talking about, even if you have insurance, how are you moving through the system and knocking down the racism that still exists even in the healthcare system at large?
Okay. Senator, did you have anything to add to that?
Yeah, I mean, I think that there is a number of things that we need to do to obviously address, a number of these issues as we look at COVID, particularly from the perspective of both myself and the Congresswoman. There's really kind of two parts of this, right? There's the pandemic itself and trying to address the actual issues of the pandemic, and then there's all the fallout from the pandemic. So like one of the first things we started doing, and I really give a lot of credit to Congress, the folks there, Grace, my senator and my constituent, Chuck Schumer, Yvette, Hakeem, Nydia Velázquez, all did a really good job at doing really three things. One, leading the charge to make sure that relief checks got to people. I'm not saying it was enough, but it was certainly, it was good. I donated my relief check, by the way, to the Campaign Against Hunger in New York for food. But, getting that done, the work around unemployment, providing more money for unemployment, making it happen right away was all really, really critical. And then obviously the bailout for small businesses. And let me just say this, to give them credit, even when it didn't get implemented right the first time, they came back and did another one. And then the House has then gone further and put in another bill that they're waiting for the Senate to pass, that actually going to provide some relief for the state on things other than COVID. So we got about $11.3 billion in the first round, 5 that went to the state of New York directly, that we on the state government took $150 million of that dollars and did some rent relief and did some rent vouchers so people can get their rent paid. About $4 billion went to the MTA because the MTA was about to crash because people stopped riding the MTA. There was a billion that went to the city of New York, and then $1 billion that went to the rest of the counties in the state of New York. And so, but all that was for COVID relief. We now need things for just running our hospitals, running, public protection, running housing, healthcare, all that stuff. The city and Nick and obviously Wendy may have a different idea about the number, but my understanding is that the city, which by the way has the 4th largest budget in the entire country, right? So think about this, the city of New York has a budget that's larger than 48 states, right? So other than California and New York, the city of New York's budget is larger than every other state's. Is around $90 billion. They're about $4 billion in deficit. The city of New York was the 2nd largest budget, well, 3rd largest budget after the federal government in the state of California, is about $13.5 billion worth of deficit. And so there's a lot of things that need to be done. We in the state legislature last week passed some legislation to deal with some of the issues, including the rent voucher bill that I talked about. I did a bill as the chairman of the Energy and Telecom Committee that made sure that there was a moratorium on shutoffs and gave people a long time to resolve their bills. I also passed a bill that requires the Office of Health Disparities in the Department of Health to do a study of the impact on COVID on African American and Latinx communities. And so I think that's going to be important to see that as we go forward. But we did a number of other things to ensure benefits and to make sure that as we're dealing with COVID, that people have pretty much what they need. Do we have everything they need? Far from it. But certainly we've been working on both the federal and the state level to do what we need to do in order to make sure that people have what they need.
Mm-hmm. Do you think there's any other resources out there that people may not be aware of or that are kind of low key that they should try to tap into? Wendy, I see you shaking your head.
The 3 things that we really been hearing a lot about is unemployment, food insecurity, and then educational problems. and people may, I'm sure, have some ideas about those. We're working on, we crashed the system twice, I think 3 times they crashed the entire Department of Labor system. We have had more people, we have literally 60 times the number of people applying for unemployment insurance because of this than we've ever had on the state level. And so that's been a problem. We continue to upgrade the system and try to expand it. But so that's kind of working a little bit better. And food insecurity continues to be a long-term problem that we're going to have to continue to deal with, as well as some of the stuff around education that I'm sure that Nick and the Congresswoman and Wendy have some thoughts about.
Wendy? You're muted.
Yeah, I would say if there are business owners on the call and you're trying to figure out where you can get funding in terms of grants, in terms of loans, or you just have questions about building relationships with banks, we've launched in the Comptroller's Office what's called MWBE University. It'll be taking place every week, and business owners are going to have an opportunity to hear from us on what the best practices are when it comes to PPP. So we're bringing in minority depository banks. So thank Congresswoman Meng for that. And we're going to be making sure that we have opportunities and talk through the federal funding as well. But what we also do is we talk about what private sector funding is available. And we give people an opportunity what they don't have the time to do during the day. So we have an expert on the ground. They're checking every day to see what those big Fortune 500 companies are doing, what small grant opportunities they are. So far, we've engaged about 1,500 businesses. We expect to engage a lot more in the next upcoming month. So I do encourage that if you have an opportunity to go to our website, you can Google Comptroller Scott Stringer and go to MWBE University. It'll come up and it'll give you the next date. But they've been, so far, we've gotten really good feedback about the information and the content. And we do offer numbers and an overview of how you can contract with the city. So the other part we do during the virtual is if you're just trying to figure out, let's say you have a food service, we'll talk you through how the Department of Aging and how the Department of Sanitation is moving their dollars around food. There are small discretionary items that agencies are still buying. So we'll talk you through how to do business with the city as well. So it has a variety of content. So I encourage everybody to go to our website.
Yeah, that's great information. And we just dropped that website in our comments. So if anybody needs it, it's in the comments. Did anybody else have anything to add to any resources that they may know about, anything that might be helpful to our attendees?
Yeah, a couple more just to put on the table when we talk about food insecurity. The DOE has been making box lunches, offer 3 times a day. You can pick those up at any local public school. And then in terms of healthcare insurance, which I talked about earlier, the mayor of the city launched NYC Care, which purports to offer folks who are without health insurance, can't, join the Obamacare exchanges or any other insurance at the city level or through a public hospital. But our website has those as well at advocate.nyc.gov, so you can check that out as well.
Wonderful. Congresswoman?
Yeah, I just want to add, there are existing resources, but they aren't available for everyone. And that's really the problem and the core of the issues that we're talking about. Wendy talks about this astounding number where 80% in New York City are women or people of color. My colleagues are 80% men in Congress. And so the 80% of a diverse New York City might not be their top, constituency. When Congress passed legislation, whether it's cash stimulus payments or expanding unemployment benefits, many people in New York, about 200,000 New Yorkers, were not able to get access to any of that money. You had to have a social security number. You couldn't even be married to someone who didn't have a social number. 200,000 New Yorkers didn't benefit from what Congress did. And we talk about food access. Yes, there's amazing food access, but the federal government needs to do more to connect some of the dots or mend some of these really obvious gaps, you know. So for example, for SNAP benefits, traditionally, you're not allowed to use your benefits to buy hot foods. So what if you're like an essential worker? You are working a 12, 15-hour shift. You don't have time to stand online at your grocery store and then go cook a meal when it's so obvious you could probably buy a hot food and help a local small business restaurant. Also, with our local ethnic supermarkets and bodegas, this is something that is maybe more unique to areas that are diverse. We don't all have like a food universe in our neighborhood. And at the same time, we have farms in upstate New York, around the country, who are literally dumping their food because they don't have the proper packaging, if you will, to get the food to our local neighborhoods. So there are resources. We just have to make it more equitable and easier to access. And lastly, I want to add something that is near and dear to my heart, and I've learned about it from a lot of my colleagues around the country and also from a Comptroller Stringer report. 30% of New York City children don't have access or devices for the internet. I've been working a lot. Mr. Clyburn in South Carolina, our majority whip, has been championing this issue for years. And we got it into our HEROES Act, a $2 billion plus fund, so that the 12 million children across the country who cannot physically be homeschooled right now because they don't have a device or they don't have internet. We can't talk about equity until we allow them the same opportunities to learn.
Exactly.
But there's a couple of lines, if phone numbers I can give if you want.
Yes, we'll put them in our chat. Do you want to send them over?
Yeah, but people should know that there is an emotional support line that the state launched. That people can call. So if people are having emotional issues or not feeling well, there's a number there, 844-863-9314. That's 844-863-9314. And then also we just have a general COVID emergency line here in the state of New York. So sorry, helpline, not emergency line, it's a helpline. So if people have any questions about COVID-19 or anything related to the pandemic, you can call 888-364-3065. That's 888-364-3065. And we have a corresponding website at www.coronavirus.health.ny.gov. Again, that's www.coronavirus.health.ny.gov. Also, the Attorney General has done a lot around the issue of price gouging. And so they have developed a way that you can call in and a helpline around price gouging. So if you're finding that where people are selling eggs for $12 a dozen, something like crazy like that, you can call 800-771-7755, or you can go to www.ag.ny.gov and make a complaint online as well. And then just one last thing, two last things. One, the same number I gave you before, 888-364-3065, you can use that to get a test. So if you think that you have coronavirus and you want to get a test, a diagnostic test, you can call them, make an appointment. And there's about 150 locations in the city of New York now that you can get a test, about 700 locations around the state where you can get a test and find out what's going on. And then one of the unintended consequences of the stay-at-home order has been a significant rise on domestic violence reports in cases. And we know that domestic violence is not even reported nearly at the incident rate. And so if you or somebody that you know is unfortunately experiencing domestic violence, you should call 800-942-6906. Again, that's 800-942-6906. And they can help you find another place to stay. They can help you get a court date. They can help you get a order of protection and those kind of things. And so people should reach out and make sure they get help.
Really, really great information. Thank you. All of those phone numbers and websites are in our chat for everyone who wants that information. I just wanted to ask, they're saying that there's going to be a second wave. Do you think our communities of color are prepared for that? And if not, how can we get ready for it? Nick, I'll start with you.
I'm gonna say no, and I don't know how we say we're ready, and when we're talking about all of these sort of underlying conditions that we are yet to resolve. So I think there are things right now that we know, like we know we've had an issue with PPEs. So I think on that level, you know, our three levels of government should be doing a better job of stocking up with PPEs and making sure we have sufficient ventilators and the equipment. So I guess in that level, possibly, but I think it'll take just a longer time to address the issues that the Senator, Congresswoman, and Wendy were getting at. So it's gonna take all of us at all levels of government to keep, you know, pushing to solve those issues.
Mm-hmm. Does anybody else want to add to that?
Well, I think before we either hit a second wave or even reopen our economy in New York State and across the country, there's a couple things we need to do. We need to have a real strategy for testing. You know, some of you have kids, you know, I use this example and I don't mean to make light of the situation, but you know, in our public schools, when a kid in your class has lice, we have a more centralized testing strategy and tracing and isolation, and obviously whatever you do to treat, than the president does for the coronavirus. So how can we talk about reopening when we don't have any sort of strategy? Every call I have with the administration, it's like every few weeks, it's a different person in charge. I can't tell. It's so hard to, you know, like Senator knows, to try to take care of your constituents when there's no stability and no will to help people at the top. And second, we have to make sure that we are taking care of our essential workers. Our essential workers, our frontline workers, have risked everything, have risked their own family's health to take care of the rest of us. And most of them are people of color. Just like we saw our first responders rush into the Twin Towers, we see our essential workers, all the ones that Kevin mentioned, rush into their work situations to take care of us so that we could safely quarantine. And we need to make sure that we are helping all of them, from the grocery store workers to the transit operators, you know, everyone, including the healthcare workers. And lastly, you know, Congress passed legislation to get money in the pockets of Americans. But like I mentioned, we need the Senate to pass the HEROES Act, because the money that's been passed so far doesn't reach all Americans. There are many people who have not benefited at all from what Congress has done. So that's the very least of what we need to do.
Mm-hmm. Wendy, did you have anything to add to that?
No, I mean, I would definitely echo. I think Congressman Meng hit it right on the notch, which is like, let's take care of the problem that's happening now before matters get worse. Look, we cannot predict what's going to happen in 2-3 months, but we definitely can look at what patterns have happened in the last 2-3 months and make sure that those things don't repeat itself. That's what this is about. And so we need to put all our heads together and figure out a way to hold this president accountable, because it's part of the issue. We don't have leadership in Washington right now. And at the end of the day, when you look at, just to go back to the systemic rules, when you look at how everyone in our respected offices gets things done, we can all tell you, and I'm sure everybody will agree, that there's an aspect to what we do that is federally regulated. That every single time we walk into that space, we hit a federal law. And so until those things start reshaping themselves, it's not gonna give people the leg room to really push out. We need leadership in Washington. That's why I'm happy that these protests are taking place, because people are done, they're fed up. And while we're sitting here having these conversations about, you know, this is a great conversation, like the color of COVID. The color of COVID has been inequality, right? It has been about ongoing vulnerable voices that have not been heard for years and centuries. And so here we are having this conversation again in another decade. And clearly it's not the individuals, it's the system. So we need to figure this out.
Yeah, I totally agree with Wendy. Look, there's no, and the Congresswoman also alluded to the fact that we're not getting any leadership from the federal government, right? And so we're kind of in what I've been hearing Borough President Eric Adams say, we're in SOS mode, right? Which is save ourselves, right? And so as we start looking, as we start beginning to think about how we reopen in the state of New York, and particularly in the city of New York, we're then simultaneously looking towards, Labor Day, when they're saying, somewhere between Labor Day and Halloween, we may get a second wave. And so we're going to need to start saving ourselves, right? And what does that mean? That means that we're going to have to start doing pandemic preparation, right? And so we saw what we needed in terms, like, we've been through this one time before, so we know what we need to do in our homes. We need to start, those of us who are not exercising, we need to start exercising, eating right, drinking water, taking supplements. Like, we got to build our own, it's a virus, right? So there's a minimum amount that the healthcare system can do anyway. It's really your ability to build your own immune system to get out of it. Some of these diseases that we have are lifestyle diseases, right? And so, diabetes and some of these other ones we can really treat. Asthma, to a certain degree, we really got to get on talking to our elected officials and our state representatives about air quality and what's happening in terms of those things, and making sure that we deal with that. Now, we've just passed CLCPA, the Community Leadership and I can't think of what the whole acronym is, but it's the most aggressive climate laws in the entire country, right? But we're still implementing those things. We have to be engaged in that process. But food, exercise, drinking water, taking supplements that we know work are going to be, important for us. And then engaging with institutions in our community that can help us as we continue to, deal with food insecurity, deal with education, deal with healthcare with our small businesses. In New York, as I hear Wendy talk about small businesses. We have Maya Wiley, who used to work in the administration, running the CCRB, now runs something called Thrive Flatbush, that's helping organizations apply for the P3 program and helping them get loans and grants so they can continue to go. We have organizations like the Campaign Against Hunger, run by Dr. Melanie Samuels. It has 51 sites. They went from serving 3 million meals in 2019 to serving 1 million meals a month since February. And so there's organizations out there doing that, and we have to both connect with those organizations to continue to build and support their capacity while we continue to build the dynamics in our homes, because there is no help coming from any place else, not really. And so we're really going to have to do some things to take care of ourselves and really address those needs in our own communities.
And I have one quick point to what the senator is saying, and it's a good point. He talks about organizations and offering services to people of New York, and of course, folks who are across the country. In New York City, we're in the middle of our budget process. And so right when COVID hit, the mayor announced and the governor announced a reduction in those separate budgets, and then they prioritized what they call health and safety programs. But that's because they say we're going to prioritize health and safety doesn't mean that your particular program will make the cut. So it's critical now that you raise the issue on your social media channels to your council members, your elected officials, particularly at the city level, and make them aware of what programs in your cities are viable, whether it deals with food insecurity, whether it deals with employing your kid for the summer. And the mayor cut SYEP. We want a new model for SYEP. So right now is the time literally to speak out, to get your electeds to make clear to the mayor and the speaker, these are critical programs that we rely on as a family, and they should not be cut. Now is literally the time to do that.
Most definitely now is very critical time. So over the past few days, we saw, unfortunately, a citizen, Mr. Floyd, get murdered. Basically, we were all able to see it live happen. And then the unrest that followed behind that. New York City has had, I think this might be the 6th or 7th day of protests that have turned into riots. What is your position on these protests, on the rioting, on the looting that's happening? Last night, I think, might have been one of the worst nights that we had. It kind of made its way uptown to the Bronx. There was a lot of looting. A lot of those businesses up there are owned by people of color, immigrants, you know, they've saved the money themselves. They are families who run those businesses, those small mom and pop kind of shops, bodegas and stores, and you know, destroyed. I saw people this morning on the news crying because their businesses were destroyed. What do you guys think about this? And I'll start with Senator Parker and work my way up.
All the easy questions, you're gonna start with somebody else and get to the hard one. You're gonna be like, Kev, go ahead. Look, this is complicated. This is extremely complicated because we're dealing with multiple issues right now. Certainly, what happened to George Floyd out in Minneapolis, Minnesota, is horrific and you know, people's worst nightmare. Part of what the dynamic is that's interesting for all of us as an elected office is that if you don't represent Minneapolis, you're like, well, I ain't got nothing to do with that really. Like we haven't, you know, we've had our own problems, right? We had, you know, Eric Garner in Staten Island a few years ago, right? Since then, we've elected our own mayor. We've elected the first Puerto Rican district attorney in the country. We have Darcel Clark, who's now up in the Bronx. We got Melinda Katz in Queens. And so we've actually done some things structurally to start getting equality. Even there was a brother who put his knee on somebody a couple of months ago around social distancing, and immediately he was put on a duty, a desk duty, right? Yeah. And looking at disciplinary charges, right? And so I think that in New York that we have started to address those things. We met today, both the and you'll remember this, Grace, the Black, Puerto Rican, Hispanic, and Asian caucus. At one point, she was the Asian and Asian caucus. But we met today for 2 hours. I also was in another meeting with the Democratic Conference of the State Senate, where we talked about legislation, including 50A, that would essentially repeal, the human resource protections, the personnel protections that some folks get, but doing it in a way that's smart, where we don't expose things that are dangerous, but certainly get to things that allow us to know what bad cops have been doing over time. The issue of special prosecutor and making our attorney general a special prosecutor on issues that relates to police officers is difficult for a DA to prosecute a cop, in part because they have to build their cases on those relationships between police officers and DAs. Looking at things, I carry a 911 bill that will create a civil penalty for people who are using 911 to weaponize it against people of color. I have another bill that I'm hoping that we pass that creates an independent inspector general over law enforcement in the state, so that the policy and procedures that police officers are doing. We do have one that actually Jumaane Williams passed when he was a city councilman on the city level. We now need that same dynamic for all law enforcement in the state of New York, and so we're hoping to pass that. And then the Stat Act, Brad Hoylman in my conference carries that, and would collect the statistics around police shootings and those kind of things. And so, and then Brian Benjamin has a bill that actually would criminalize chokeholds and things like you saw that was done to George Floyd. And so, so we're looking at some bills. We're hoping that they'll come to the floor, like I said, by next week, and we're able to turn this around. But that's part of what we need to do. But there's a lot more work that needs to be done around the attitude of police and the attitude of people in our communities. I think the demonstrating has been right on, and I think that it's righteous and certainly raises the issues and has created, frankly, an environment for the bills that I'm talking about getting passed. Because none of these bills that I'm talking about were put in last week, right? I've been carrying the 911 bill for 2 years. For 2 years, I carried the bill on special prosecutor for 10 years, right? And haven't been able to get a venue to get anybody to pass it. Now all of a sudden we having a conference. Now it's easy to do, right? And so I think the protests have been right on time and have been, the right thing to do. I think the looting, I think the vandalizing, I think, burning of police cars and those other things have been out of bounds, and certainly not the way that we need to act. And frankly, at the end of the day, we want to pay for that because, we have to rebuy police cars and clean up the damage as taxpayers. And so, damaging and looting, certainly I don't condone, but peaceful demonstrating and certainly reaching out to elected officials through various means is certainly what you should be doing every single day, and hoping that this will spark the idea in folks' minds that politics is not just an event. It's not just about coming out to vote, right? For instance, on the June 23rd primary in the state of New York, but it's really it's not an event. It's a process, and people need to be engaged in the process. People need to, join their block associations, their tenant associations, their NWCPs, their urban leagues, and other community-based organizations that's doing this work. Their churches, their mosques, their synagogues, to mobilize those institutions to fight for justice every single day.
Thank you, Senator. Congresswoman, do you have anything to add to that? Just talking about the recent protests.
People are hurting. People are angry, understandably so. Yes, the latest murder is of George Floyd, but a lot of this discrimination, as we've talked about it, and racism starts at birth. I'm a member of a task force in Congress, the Black Maternal Health Caucus. There are inequities that literally start from birth because of the color of one's skin. I obviously am not an African-American, but I am an ally, and it is literally my job to make sure that whether it is these protests or legislation or just conversations, that I'm doing my part in making sure that I'm helping to provide a platform to hear the stories, the real life stories that are the reasons why people feel so hurt. I can say that in the past few months, you talked about it earlier, when there was a lot of discrimination against Asian Americans, even before the virus actually hit us here in the United States. One of the first people, so I had a resolution to condemn this anti-Asian sentiment. One of the first people that signed on was my colleague, Congresswoman Karen Bass, who's chair of the Congressional Black Caucus. The NAACP, National Urban League, they were amongst the first groups to publicly and nationally condemn this anti-Asian sentiment. And so it is part of my job to help build bridges. And I think we have an incredible opportunity to do so. We have newer communities here. I've been spending the last few days talking to people in the Asian media and in the Asian community leaders, because there might be a lack of understanding. There might be a new immigrant who never fully knew or understood issues like segregation. They've never experienced it. They might not even know the history of the laws that our Congress passed to prevent Chinese people from becoming citizens. So there's a tremendous opportunity for education. And as I was explaining about discrimination to my two boys in the last few months, we talked about discrimination and racism, but I never had to deal with the fear that a mom or dad of a Black son would have to deal with and worry that their kid might not come home ever again. And so these are the realities, these are the conversations that we need to be having. And my goal is to be that ally, to make sure that we are focused on the message, that we are protesting with a purpose. And like the senator said, that we are coming out with good and purposeful and helpful legislation, and not to waste this opportunity.
Definitely. Nick, do you have anything to add to that?
I do. And this is a really, as the senator said, tough question, but a good question. And I think I just want to talk just for a second about what George Floyd's murder means to me. And I think what it also means to young people, because I know so many young people are seeing something like this for the first time in their lives. I am originally from Los Angeles, California. And I remember at about 1992, 93, when I was about 7, looking out the window one day and seeing Army tanks rolling down the street. And I recall seeing all these small businesses burning. And, I turn on the TV and I see then President Bush Sr. basically saying, you people in Los Angeles are rioting over the Rodney King. You need to stop burning down your own communities and essentially victim blaming. And so when I sort of remember, that in sort of vague ways, that was my first introduction, I think, to racism, to police violence, and to issues that I think people of color and particularly Black people deal with on a daily basis. And then when I saw, fast forward to a few days ago, when I saw a man who looked like me, tall, Black, dark-skinned man on the ground in the street with a white police officer with his knee jammed into critical arteries and his neck, that was a reminder to me that this country has a long way to go in rooting out systemic racism, bias, and I want to say anti-Black systemic racism and anti-Black bias. We are not there yet. And, I know many people say, well, we're in a post-racial society. We elected the first Black president of this country. I don't know how you argue post-racial society when the current president was elected, in my mind, based on a backlash, based on this Black president's very presence. Yeah. That isn't a post-racial society. So when it comes to young people, I just hope that they understand that the image that they saw of this Black man being murdered and the consequential, thinking that we are less than, we cannot believe that. We have such a rich history as Black people, and we need to just really remember that. And I absolutely support the right of protest. We've been, knees have been in our necks for far too long. Black folks in this country have been suffocating for far too long. We talked about small businesses with Wendy. It's hard for us to get loans to open them small businesses in our own communities. It's very difficult to get mortgages to buy our own homes. Therefore, it's difficult to build generational wealth. Those are all systemic issues. And so when it comes to, okay, so what do we do? I think the Senator and the Congresswoman and Wendy talked about legislation that we need to pass. And I just want to make sure that I put on the table what the Public Advocate's Office is also pushing. And some of it we've talked about, just a couple of points. One, the Senator mentioned this one, 50A. We personally support a full repeal of the 50A civil rights law because there's no reason, and yes, we should protect information that would cause any danger to an officer, but the public has the right to know that if an officer isn't, engaging in excessive force or brutality, do they have a history of complaints against them? That's the question that we need to know. I think the Senator also mentioned an independent inspector general based on the law that Jumaane passed in 2013. Yes, we need to build on the Community Safety Act and have a truly independent inspector general. When it comes to the police commissioner, it's our posture that we want the city council to have advice and consent power over what commissioner runs the police department, so that the council, who are the representatives of the people, as is the mayor, but from more of a local perspective, can ask a designee, what is your opinion on excessive force? What is your opinion on officer discipline, et cetera? We got to know these things before someone takes office, or otherwise it's too late. And the mayor and the commissioner do set the tone for how their police department acts. We also need to strengthen what's called the Civilian Complaint Review Board, CCRB. That was created during the Dinkins administration with the mission of allowing New York City residents to file complaints if they feel like they've been abused by a police officer. So things like sexual harassment, things like using vulgarity, things like excessive force. That's a body that right now accepts complaints, investigates, but the issue there is they need more teeth. So their recommendations right now are just that, recommendations, but those things need to be binding. The discipline that they may recommend need to be binding. And I'm almost done, but when we talk about transparency in the police department, we carry a bill that will require the reporting by the police department on what's called level 1 and level 2 stops. So we want to know if an officer is engaging with the public, but for stuff like, directions to something. But for that, if you're engaging with the public, we want to know the details of that engagement. Was there an arrest? Was there an accusation of a crime committed? Was there a violation, et cetera? We need transparency when it comes to the police department. And the last thing I'll just add, and I think the senator also mentioned earlier when it comes to, actually a few folks mentioned it, mental health. We have to have a radical change in our mental health response system. So number one, it's knocking down the stigma, particularly, and I'll speak for myself, among Black folks. It can be a little bit of a stigma to decide to reach out to a therapist. I'll be upfront. I myself now have a therapist. I think it's important to maintain not only your body, but your mind, and going to therapy is an important thing to do. When it comes to city policy, we've got to move away from a police first response when someone calls the police or 311 with a mental health complaint. Because we've seen in the case, for example, of Deborah Danner, of so many other New Yorkers, that when you send a uniformed, armed officer to allegedly de-escalate a situation with someone who is going through a potential crisis, the mere presence of someone with a badge, a gun, and a NYPD uniform probably isn't going to de-escalate. In fact, the likelihood is that you're going to escalate, because that's an inherently adversarial interaction. So we need to really bring in peers to either have a co-response, or they'll be the first responders to respond to these calls. So those are a few of the policy recommendations that we need to have happen. And just to wrap all that up, this is a moment when it comes to COVID-19 racial disparity, and when it comes to this senseless murder. Those two things, I hope, create a critical mass to move elected officials at all three levels. And I have more faith to be very open about New York City electeds and the state electeds. And of course, our friends in the Congress, but when it comes to the president, that's a different story. But this is a moment where we got to have all those parties move in one direction, so that finally people of color in our society feel a sense that, yes, America has a place for me too.
Yes, definitely. That's a lot of great information. I hope you guys were writing that down. Wendy, what do you feel about the recent protests?
Yeah, I was actually on a call yesterday with my son's school, and there was a great panel discussion from a researcher who had been talking about the impact of Black Lives Matter. And one of the things that he did was that he called a white supremacist and said, hey, like, what is it that you want from us? Like, what is it that you're after? And the white supremacist said, your silence or your rage. And I thought that, I heard that yesterday, and I broke into tears looking at my son, because I have a son. And I'm like, how do I teach him how to protest and be loud and not be enraged? And a lot of the parents on that call were having those very mixed feelings of like, how do you teach your boy to go out in the street and not be enraged by seeing a homicide, a murder happen right in front of him, and then at the same time try to be neutral? It's impossible. It is impossible. Mm-hmm. So if you've heard the comptroller speak, if any of you have heard Scott Stringer, he's talked a lot about this, in that, of course, we're on the side of the protesters. We've even as electeds, we feel as unheard as everyone else, as crazy as that sounds. Sometimes you are inside of an office and the system is so big that you're pulling levers and you're introducing legislation. I think this is what Senator Parker was talking about. And you're thinking, like, why doesn't this get passed? Like, why can't I go from Senate to Congress to president? Why can't I move these levers into another section of government? And I think this is a time, as Nick said, that all of us have to be moving together. It is a time that we're sick of it. This is, our kids should not be living through the same story that happened in Detroit years ago, that happened during the civil rights movement, that happened in the farms in California. I mean, this is not a new story. This is a repeated story that hasn't found any solution. And so that is what happens in history. History will repeat itself until we solve it. And so I'm with the protesters. I'm with the protesters hardcore. I want to see change happen just as much as anyone else. I am Dominican. My family are majority immigrants. We are Black. And at the end of the day, we're sitting here in this space the same way everyone else has, in that we have come up the ranks in the same way that, and we find ourselves caged in. And how do you create an America that says everyone is equal? But it's not true. It's just not. It's not true. And I think it is. This is such a good time to use this opportunity to highlight the words and the rage and the anger of the protesters, because I think it's important to understand that it's okay to be angry. The looting is something completely separate. These are separate people, and people have to understand that the two do not coexist together. Anyone who protests is not looting. It's not the same thing. No one looting is like, hey, you know what I really want to see? X, Y, and Z. No, that is not what's happening. Looters are looters, and they have to be treated very separately under very different circumstances. And we have to be clear that there are two different matters happening at the same time. Imagine in your house, if you have a child who's like doing their job, and then someone comes in and like knocks down your door, and now your child can't work. Do you then blame the kid because he's not like doing his homework? Like, they just knocked down his door. He had to stop for a little bit. And so we have to be very clear as a government in terms of like learning perspective here and seeing things through the lens of what is really happening and what is not happening. What is really happening is that the average number of contracts in terms of contract dollars that goes to business owners right now in the city of New York is no more than $65,000 on a contract, no more than $75,000. So what happens? You have people that are not building wealth. And when you're not building wealth in those communities, when people can't get to the $1 million mark, when they can't get to the $500,000 mark because government is not providing the access to those businesses, and then someone comes to loot and someone comes to vandalize their property, you are creating more poverty. But those are not the protesters. And so people have to be clear that that is not the Black Lives Matter movement. That is a taking advantage of the situation.
Yeah, I heard that there was a lot of outside agitators that have come into the city and are causing a lot of havoc. If anyone has to drop off, I know we went a little bit over time. If you have to drop off, I'm going to open it up for Q&A now, but if anybody has to leave, feel free to just vanish into Zoom, into the Zoom atmosphere. Okay, let me see. Carvel, do you want to send out the questions or should I just read them here?
Sure, Radia. So we do have one question that came in earlier. So they were saying, how are they asking for ventilators? So I'm assuming, how's the state asking for ventilators if they have not used them and a lot of nurses and doctors are being furloughed?
So this is a complicated issue. And so, when we were talking about, when this was months ago, right? Like going to like the beginning of March, right? When we first began the shutdown order and those kind of things, is that we were looking at a trajectory of having possibly a modeling of about 140,000 people sick, literally in the hospital at the same time. That number was scary because at the time we only had 53,000 available hospital beds around the state. And we didn't know how it was going to hit. And so at the time, what you saw the governor do is start preparing to have 140,000 beds wherever they could be, right? So we got the USS Comfort come in, we converted some space at the Javits Center. He asked every single hospital to double their bed count, right? And we realized that based on the modeling that we didn't have enough ventilators, and so we were trying to get enough ventilators. That, and then simultaneously, we did social distancing and the stay-at-home order. The stay-at-home order thankfully worked. We didn't even know at the time that it was a slam dunk that it was going to work, but it worked. And it frankly worked better than we had actually hoped. And so we never got to that 140 number, right? We got to, I think, around 86,000 beds at the same time, or 83,000 or something like that. But we never got to that. Thankfully, we never got to that because we actually never had the beds. So we had gotten to 140,000 people sick at the same time. We wouldn't have had any place to put them, right? And so we were asking for ventilators, PPE, all those things. The other dynamic is that, as we talked about, and what probably the basis of the call is that COVID didn't hit everybody the same. And so if you look at white communities, even in Midtown, like Upper East Side, Upper West Side, didn't get hit the way Elmhurst got hit in Queens, the way the Bronx got hit, the way Brooklyn got hit, right? Upstate New York didn't get hit the way New York City, Nassau, Rockland, Suffolk got hit, right? And so there are parts of the state in which we had, ventilators that we didn't need, and we had hospitals that didn't have enough ventilators. And so part of the conversation, if you were watching the governor's briefings, was trying to, was developing a conglomerate in terms of how hospitals operated, such that we could move equipment, PPE, ventilators, and the such into the places that we needed it from places in which we didn't need it. Now, some doctors and nurses in some rural areas were being furloughed because, along with the stay-at-home order, one of the things that were stopped was what's called elective surgeries. Now, this is something I learned during the time too. I used to think of an elective surgery as maybe a plastic surgery, like your nose fixed, a rhinoplasty or something like that. That is an elective surgery, but an elective surgery literally is anything that you schedule. So you could be, unfortunately, somebody with cancer who needs to get a lumpectomy, right? Or some other kind of, or mastectomy or something like that. And because it's scheduled, it's deemed a elective surgery. And so all of those elective surgeries for about 2 months were canceled. Hospitals make their money on elective surgeries. And so hospitals weren't making money. Nobody's coming in the hospital because people are scared to get COVID. And so they lost money. And so they were putting people on furlough. That was not the case in New York City, Nassau, Suffolk, Rockland, right? Westchester, where nurses and hospitals were working overtime to deal with their patients. And so that was the dynamic that we were going on. We have now resumed in the state of New York elective surgeries. And so a lot of the people who were furloughed are now back fully on payroll, and those hospitals are operating a little bit like normal. Even Downstate Hospital, which was actually deemed a COVID-only hospital, is now back to doing elective surgeries and doing some of its regular activities, now that we've done a better job at social distancing. And as we start thinking about this, relaxing the stay-at-home order, people should understand this. Relaxing the stay-at-home order does not mean that social distancing is over. It does not mean that COVID is over. It just means that we're relaxing staying at home. People need to go back to work, but people need to wear masks. People need to continue to social distance. People need to continue to protect themselves. This virus is still out there. We're still in what I call the DC period during COVID, right? Everything before March 7th, March 7th was BC, before COVID. And we're going to be a couple of years before we get to AC after COVID. But right now we're still in the DC period. And so people need to act and behave accordingly.
Mm-hmm. Yes, we're going to answer a couple more questions. But Nick, I wanted to say, I heard Jumaane speak. It might have been, the days meld into each other. It might have been today or yesterday. He said something about if you want to look towards a good leader, look towards a Black woman. We really appreciate, sometimes we get treated like we're at the bottom of the barrel. They say the most disrespected person in the world is the Black woman. So just to hear someone big us up, really appreciate our leadership skills, our nurturing skills. So I just wanted to let you know, I know you can't speak for him, but just let him know that we appreciated that.
I can take any credit. So. No, I mean, the reality is Black women are the cradle of civilization. So I think he's right in giving Black women credit.
That's right.
But Radia, let me just also say something on that point, because I think in the state of New York, the public advocate is stating something rightly that we've already acted on in the state of New York, right? Like people will talk about when Black Panther was out, like going to visit Wakanda. It's something where you've had Wakanda in the state of New York for a long time, right? We have the only African American woman attorney general in the entire country, right? We have we have two legislative bodies, a state assembly and a state senate. They both have African Americans. The state senate is run by an African American woman, right? And we actually have the largest delegation of African American women elected to a state legislature in the history of the United States, elected right this moment in the New York State legislature, right? And so the state legislature is replete with African American women, including the second in command, who's the majority leader, Crystal Stokes from Buffalo, who's very prominent, very, very active. You have here in Brooklyn, Rodney's Bashat, who is African American county leader, right? And Black women in politics, I know, have been at a very, very high level, and of course, not to mention the woman who walks in Shirley Chisholm's footsteps, holding her seat, my good friend Yvette D. Clarke, who represents us very, very well, is an immigrant and has been the leader on immigrant issues and housing issues across Brooklyn and across the nation in DC. And so we have that leadership there. More needs to be done, but I don't want people to think that we're at a place where that leadership is all lacking here in the state of New York.
Mm-hmm. Well, that is good to know. I know it's very empowering, and we love to see women in those roles. And it's encouraging because, we are faced with so much is going on. And then when you see someone who looks like you and they're leading the charge and they're smart and they're intelligent and they have it together, it's great to see. Someone asked, and I'll just throw this to the Congresswoman, have you learned any personal lessons throughout this, this pandemic?
Well, I think we've learned that this president has no will to save the lives of his constituents, the American people. I think we've learned, I don't know what I expected, but that we cannot depend on him at all if we ever hit a second wave. And that's been utterly disappointing that, we talked about PPE. This is a president who wouldn't invoke and use his powers of the Defense Production Act to get PPE for our constituents when he's done it hundreds of thousands of times just in his short time in his administration. So what I've learned is that we need to, as a whole, make investments early on, whether it's our healthcare system and educational system. And, I will say that, as we all advocate for people filling out the census, there's been no better time than these days to help people have a sort of visual of why it's important to fill out the census. We can literally say to our constituents, if you want more hospital beds, if you want more seats for your schools, resources for your kids, you have to fill out the census. And so I think I've just really realized it's just been demonstrated that there are tremendous disparities and we have to continue to fight. As Speaker Pelosi has said, there will be no cheaper time or more cost-effective time than to make these investments into our communities and their systems.
Mm-hmm. The time is now. It really is now. Wendy, have you learned anything, any personal revelations that you've learned during this whole pandemic?
I would say my personal revelation is that, and this is just on the way we've all been sort of living in general, just to pull a little bit out of just the heavy content, is that we are getting, to Grace's point, in that we're learning how to rely on ourselves a lot more. And that can translate into, you learn how to, it kind of highlighted, at least for me, when all the transition was happening and we were all talking, I was talking to the controller in the office about like, okay, so what could we do? In a matter of a week or two, we put together some ideas very quickly on like what we needed to put out, right? So we knew that because we were the data folks, like let's put out the 75% number. People need to understand who were the essential workers. I don't know, we've always done this work. Like we've always done the work of diversity and inclusion and equity, but definitely the pandemic has pushed people almost like, you know, it's like you swim when you're about to swim instead of someone like, you know, you're learning how to swim slowly. This was kind of like,
Push you in.
push you in. You're gonna produce, and you're gonna produce this quickly. And so I think learning how to utilize our government authority to produce quickly for the people of New York, to produce effectively. And also it has been a great reminder that for those of us doing the work previously, right, that I love when Senator Parker was like, I introduced this a long time ago because it's understand where he's coming from. And in that it's kind of like, oh yeah, if you ever had a doubting moment in your mind that this was not the thing to do, or maybe you're like, it's not the right time, it had always been the right time. And so, and if for me, the personal lesson is it has always been the right time. Never be scared to sort of push that, because it really has been about will. And we don't, you know, unfortunately, we don't have a president who is a leader. But we do have the will of many elected officials in the city of New York. And there's a lot of good people in government doing this work and pushing this. And this is a time where at least many of us, I don't want to speak on behalf of all government reps, but I could tell you this is a time that I see it in my office day in, day out. The brain work and the mechanics that's happening on a daily basis in my office, we're working so much harder now than we did before. I mean, we worked hard before, a lot harder for sure now, because there's the elevation and the need and the demand for a lot of this.
It's bedtime.
Curfew, bedtime, bedtime has been definite. It has really pushed everyone into a creative space that I think was much needed. And I think that it has pushed us definitely into innovation, which is a good thing. I mean, an innovation always hurts and it's painful, but I think at the end of the day, we're gonna come out on top.
Definitely. Nick, anything for you? Any personal revelations or anything that you have discovered about yourself or discovered about your community during the pandemic?
Yeah, when you asked the question, I thought of actually a line that the public advocate himself says quite a bit, which is do what you can with what you have where you are. And so I think for me, it is, I have an expertise in legislation and, you know, so finding solutions to issues based on people on the ground living the experience and translating it into policy changes. And so I think no matter where you, if you're expert in, you know, passing bills or you know, MWBE issues or whatever your station is professionally in life, now's the time to really double down and bring those skills to the table, because it's going to really require all of us to there won't be a new, we don't go back to normal. There would be a new normal, and we're going to have to figure out, you know, what our expertises are, bring it to the table, so we can craft a new normal that is as beneficial as possible, particularly for the disadvantages among us that we're focusing on in this conversation tonight.
Yes, thank you. Senator Parker?
Well, the first thing is that I've learned about the COVID period is that Nick is a new father. Who knew?
Congratulations.
Oh, he had twins.
Two at once, yeah, two girls.
Yeah, congratulations. You
Thank
Bobby Beige now. Yeah. So that's the first revelations. That was like, and probably the most important one. I think secondarily, I have really learned a lot about, and I don't know if I learned it, but it's reconfirmed to me about my community and my people, about how resilient they are. You know, there are a lot of people who would not have gone through what we've gone through already. We were already getting our behinds kicked, you know, socially, economically, politically, but then to go through this global pandemic, to have the number of sickness, the amount of death, and people still having to go to work, and the community hasn't gone anywhere. Like, people haven't, you know, I mean, I'm not saying people ain't having issues, but people ain't bugged out, and, you know, like, you know, things could have been a lot worse. I I hear white communities, I'm gonna keep it funky. I hear a lot of white communities complaining worse than Black and Latino people. And I'm like, y'all not sick and dying. And y'all complaining more about not having to go to work, right? Than you are about, people who are, going through it. The Asian community, in which a lot of folks are also, sick at a much higher rate than the white community, dying at a much higher rate, and then dealing with the racial bias attacks. During that period, I think Grace saw it. I actually wrote a op-ed as an Asian ally about, and that ran in the Queen's paper about the fact that the attacks on Asian people around coronavirus is absolutely ridiculous. It's absolutely ridiculous. It's like killing pigs over the swine flu. I mean, it's just dumb, right? Like, it's just, and we have to also, good, understand this. We have come to this country on different ships, but we're all in the same boat. And we will either stick together or we're going to hang separately. And so, we really need to, and that's why I was really proud and glad to be involved in this conversation and this call, and why, I think NAMIC is such an important organization, because it creates that space in corporate spaces where it's a lot harder. Right? I mean, frankly, those of us in government, even though I'm not saying it's easy, particularly for Grace down in Congress, but it's a hell of a lot easy at the municipal building or in the Capitol than it is in the Viacom building, right? Or at Google or some of these other companies in which people on this call are working at. And so we all have to work together and understand and protect each other, because unless we do that, we're going to be fighting in silos and not really understanding that we share the same battle.
Definitely. Any last questions from anybody? I'm just going to see if anybody has any closing words, and then Congresswoman is going to close us out. But if you have any questions, please drop them now very quickly. I'm just getting a lot.
One really quick thing, I apologize.
Sure.
And I got to say it earlier when we're talking about COVID and potential solutions, and I have to give our team credit in the Public Advocate's Office. We did about a 70-page report, which looks at all of the areas that we're talking about. So it's housing, healthcare, transit, the like, really recommending a roadmap for how to deal with COVID-19 right now, and potentially how to recover from COVID-19. And folks can look at that report at our site, advocate.nyc.gov. It's really comprehensive, and credit to our team for putting that together.
Oh, wonderful. That's great.
And on that same note, the governor has put out a state report called NY Forward, New York Forward, that lays out the four-phase approach for the state opening back up. This week, the city of New York was actually supposed to be going to phase 1. I don't think we actually made it into phase 1, but it actually includes many of the things that you heard people talking about in terms of numbers of beds available. We had to have a 30% vacancy in both regular beds and ICU beds. Every hospital needs to have a 90-day supply of PPE, and you need to have enough tracers, contact tracers, and you need to have 30 per 1,000 people in order to kind of get to that number. And we had, as of last week, I know we had met 5 of the 7 criteria to go into phase 1. We expected to go into phase 1 on by today. I need to check. We've been involved obviously with other things, so I haven't had a chance to really drill down onto it. But over the next couple of days, if things die down, the city of New York should be in phase 1 of reopening again, which means that social distancing is being relaxed. Sorry, I apologize. The stay-at-home order is being relaxed, but social distancing, wearing a mask, and other safety measures are still in effect, and that's going to be with us for a while. And so we are going through that. The other thing too is that Congresswoman Meng mentioned something about farmers dumping food, and that was a case that was happening across the country. It was early on happening at our dairy farms. Since then, the New York State Department of Agriculture has went into a contract with dairy farmers and other folks to actually buy their surplus supply and make sure that it gets processed. So the problem was not having it, that a lot of the processing plants were closed because of the stay-at-home order or because of issues with COVID. and the state of New York has agreed to buy that stuff and make it available. And so we have actually been doing that and making that food available to pantries and soup kitchens across the state for about a month and a half now.
Oh, that makes a lot of sense, because that's a lot of wasted
Yep.
food resources. Wendy, any last words for us?
I guess I would say, if you're a business owner and you're likely shut down during this time, just remember that we have a resource in our office to help you figure out how you can continue to do business with the city of New York. One of the most important and I think items that you'll find in this space is that emergency purchase orders are happening, and they are happening every day. And MWBEs need to be part of that. So you're a minority or woman-owned business, and you have a cleaning service. Guess what? The city needs to clean up, and there is a lot of cleaning happening. Basic as that. There are seniors that need food delivered to their homes. That's super critical right now. These are businesses that are majority storefronts in our community. And really, if you pivot and you want to rethink how you can reimagine your business delivering a service, I do encourage you to call our office. One of the things that we definitely do is give a market overview of who your competitors are and how you can set yourself up to meet these numbers. And so, listen, the controller talks about this all the time. This is about building wealth. Freedom is not going to happen until we build wealth in our communities. The whole purpose of racism and supremacy is to take away power and wealth. So once we are able to, as a community, do that, get the contracts, make sure that government has all the right things in order so that we are giving those out, so that we're not giving those out, but that people can compete for them in a way, in a merited way. If COVID comes again, it's not going to look like this. It won't. And we're in a very unique place to solve for a lot of those problems. But in the meantime, go to our office's website. I do the workshops every other week or so. So please feel free to contact us.
Yes, that's a great resource. A lot of our members have, side hustles. This is a professional organization. A lot of people work in the media industry,
Right.
but their side businesses, side hustles that they work on. So that is great information. Congresswoman Meng, I know you wanted to say some closing words for us.
Well, first, thank you, Radia, and the whole Namick family for having me. Thank you to Senator Parker. It's great to see you. It's been a while. Thank you for introducing me to folks here tonight. It's such a privilege for me to be a part of this conversation. And, you asked us before what we learned, and I want to say I'm reminded of two lessons. One is the importance of being better listeners, whether it has to do with coronavirus, where we literally saw no direction from the federal government. We had no choice but to be more active and to be better listeners for our constituents and the people that we serve, because they were literally telling us on the ground every single day what they needed and what the government needs to do more of to help. And whether it's being a better listener for all that's going on as we watch the murder of Americans like George Floyd, it's how we can be better listeners to our allies. And number two, the lesson is to be continuously working to build stronger coalitions. Senator Parker mentioned that I was allowed to be a part of the Black, Puerto Rican, Hispanic, and Asian caucus in Albany when I was there. I didn't have enough colleagues to form my own Asian caucus. And it's my job to remind the Asian community that we are in the place that we are because of many of the struggles and the successes of the Black and Latino community, and our jobs are not done yet. So how can we make sure that we are expanding these coalitions, making sure that we are holding our legislators, including myself, accountable to use this moment to finally create and to improve the laws and the infrastructure that we so desperately need that, again, our constituents have known the whole time and they've felt it. So let's use this opportunity to make some real change so that no American has to fear and fear for their lives while they are jogging, sitting in their homes and not being able to breathe. None of us are free unless we can all breathe freely and equally. And so I thank you for your work, and don't hesitate to reach out to us as a resource.
Thank you so much. That is really appreciated. I just want to thank all of you for taking the time out this evening to talk with us, to enlighten us. I think this was a really good conversation, a really good start. I know there's so much work to be done. And right now we are feeling a little dejected. We're feeling a little frustrated, but I think conversations like this will lead to kind of a collective kind of synergy and maybe a little bit of motivating. I just want to encourage everyone to continue to just social distance. We have some votes coming up. I did want to ask a quick question. There's an absentee ballot kind of thing going on, which might confuse some people. I don't know if with the quarantine being relaxed, will we still be able to go out to vote, or will we still have to use that ballot?
So on Tuesday, June 23rd, there is a Democratic, actually a Democratic and Republican primary happening in the state of New York, including the vote for a Democratic nominee for president. And there's actually 3 different ways you can vote. You can early vote. That's happening approximately 2 weeks prior to the actual 23rd. And I apologize, I should know what the early vote day is, but I don't offhand. And then you can vote like regular at your regular polling site on Tuesday, June 23rd, right?
Okay.
And then in addition to that, the governor has signed an executive order that had people automatically get an absentee ballot if people don't feel comfortable going to the polls. If you did not receive an absentee ballot, you can go on the New York State Department of Elections website at www.elections.ny.gov. That's www.elections.ny.gov. And you can you can ask them to send you an absentee ballot, and you can vote by absentee ballot, or you can even call them. And unfortunately, I don't have the number off the tip of my tongue, but if you go to their website, you can see a number there. You can call them and ask for an absentee ballot.
Okay, great. Yeah, please vote. A lot of times people think it's just lip service. It is important. Please, we must vote. We must get some proper leadership in place. So everyone, we're going to wrap it up now. I think we went a little over time. I'm sorry, everybody, but thank you so much for participating and being with us. Anytime you need naming for anything, don't hesitate to reach out to Carvel and I. We are here for you. And thank you. This was a great conversation. I hope everyone got something out of it and enjoyed.
Thank you.
Thank you. Everyone take care. Thank you, everyone who joined the call. We'll send this out on
Bye, panelists.
Bye.
Send this out on
Bye.
YouTube. So you can rewatch it or share with your friends. Everyone have a good night. Stay safe. Bye.
Bye.